Hello, welcome to POC Nurse. My name is Gozi. In this video, we're going to talk about MODS, Multiple Organ Dysfunction Syndrome, the SOFA score, the Sequential Organ Failure Assessment scoring system, and trauma for the CCRN exam course. Let's start with Multiple Organ Dysfunction Syndrome, MODS. What is MODS? It is a progressive failure of two or more organ systems in a critically ill patient or an injured patient whose homeostasis can't be maintained without intervention. So, if this patient is having pulmonary issues, to restore the function of the lungs, the patient may need to be mechanically ventilated, may need to be on BiPAP or CPAP or something. An intervention has to be done. The most common organs and systems affected are the heart, the lungs, the liver, kidneys, the hematologic system, metabolic, endocrine, and coagulation systems. Now, any type of shock can cause multiple organ dysfunction syndrome. What are some clinical manifestations that we can see in a patient with MODS? It depends on the organ or the system that is affected. Let's take a look. Now, if a patient's heart is affected, if a patient with multiple organ dysfunction syndrome has any kind of cardiac dysfunction, it may be exhibited by hypotension, tachycardia, arrhythmias. The patient may require vasopressor support for hypotension. The patient may have decreased systemic vascular resistance and may have a high or low CVP and may also have high troponins. If the patient's lungs are involved, the patient may be tachypneic, patient may have dyspnea, and the patient may be hypoxemic. If the kidneys are involved, the patient's creatinine levels may be high. The patient may have a decreased GFR, glomerular filtration rate. The patient may have decreased urine output and may be oliguric. The patient may also have electrolyte imbalances that are life-threatening in nature. If the patient's endocrine system is involved, the patient may be hyper or hypoglycemic, high or low blood glucose levels. Patient may also have adrenal insufficiency. If the liver is involved, the patient's liver enzymes may be elevated, the patient may be hypoglycemic, the patient may be jaundiced and may have decreased albumin levels. If the patient is neurologically impaired due to MODS, the patient may be confused, disoriented, delirious. Patient may fall into a coma, may get lethargic, or may start having seizures. If there's hematologic involvement, the patient may have decreased protein C levels, increased D-dimer levels, thrombocytopenia, or some coagulopathy. If the patient is metabolically affected, the patient may go into metabolic acidosis or may have high lactate levels. So the kind of symptoms the patient presents with depends on the organs that are affected. Let's talk about the SOFA score. Before we do that, I want to mention the fact that, like we said before, MODS could be caused by any kind of shock. The more organs that are affected in MODS, MODS, the higher the patient's risk of death, or the patient may have an increased risk of mortality. Most of the ICU deaths, 80% of most of the ICU deaths annually are caused by MODS. Now, what is SOFA, sequential organ failure assessment? It's a scoring system. It uses lab values to assess the degree of organ dysfunction in a patient over time. Now, the score starts from 0. That's the least a patient can score, and the most a patient can score is 4 for each organ system. The higher the score, the greater the dysfunction. Now, there are 6 systems that are evaluated for the SOFA score. Is a respiratory system by using the PF ratio, coagulation system by checking a platelet count, the liver by checking the bilirubin levels, the heart by checking the patient's mean arterial pressure, MAP, and vasopressor requirement. The kidneys or the renal system, in this case, we check the patient's creatinine and urine output. We also assess the patient's neurological system by checking the patient's Glasgow Coma Scale score. That is the patient's GCS score. What is the significance of the SOFR score? It's just useful in predicting the patient's mortality. So the higher the score, the higher the patient's risk of mortality or death in the ICU. Moving on, we're going to talk about the trauma patients. For the CCRN exam, it's important to know the first and second line assessment for the patient with trauma. So that's what we're going to talk about here. So the initial assessment for the trauma patient is a primary survey where you do the ABCDE approach. You check for the airway, breathing, circulation, disability, and exposure/environment of the patient. For the patient's airway, we want to ensure the patient has a patent airway. The patient may need intubation. For the patient's breathing, the patient may require ventilation and 100% oxygen. For circulation, we want to make sure we have two large bore IVs in the patient and provide warm isotonic lactated ringers. For the disability portion, the letter D portion of this, we want to do a quick neurological exam, check the patient's level of consciousness, check the patient's motor response. Are they moving? Check the patient's pupils for any reactivity. And of course, assess the patient for the Glasgow Coma Scale score. That's the GCS score. And for exposure and environment, you want to take off the patient's clothes, provide warmth and cooling as needed, and also inspect the patient's body. That is the first line primary assessment for the trauma patient or primary survey of the trauma patient. The secondary survey for the trauma patient is the FGHI approach. So we initially did A, B, C, D, E. Now we're going to do F, G, H, and I. For the letter F, it represents a full set of vital signs. You could also do other things such as put the patient on the cardiac monitor, check the patient's pulse ox, attach a CO2 detector if the patient is receiving oxygen, place a urinary catheter so that you can accurately measure the patient's urine output. Patient may require a chest x-ray. Patient may require some kind of gastric tube, maybe an OG tube or an NG tube. The letter G portion represent giving the patient comfort measures such as pain management. H is for history, which is of course taking down the patient's history of medications they take, problems they have, allergies, things of that nature. And you want to inspect the patient's posterior for the letter I, meaning turn the patient over. The trauma patient will obviously need ongoing monitoring, so which means some of these initial assessments will continue, such as the neuro assessment will continue, patient's vital signs will continue to be monitored. We could check liver enzymes, and we can also do ABGs for the patient that is getting invasive or non-invasive respiratory support. Thanks for watching. I hope you found this video helpful. Please like, share, and subscribe, and I will see you in the next video. Bye bye now.